Hello, I'm Dr. Beech, and today I wanted to answer a question a patient had for me about detoxification, and is detox good for me? This patient came in and she was feeling very tired, a lot of stress in her life, her routine wasn't good, and she just felt like she was just accumulating toxins in her system. And she just very innocently said, how can I get rid of these toxins? And this is a question I hear a lot. And I have to say that out of all the systems of healthcare I've ever discovered, Ayurveda is by far the most comprehensive in getting rid of toxins from the system. The problem is, however, there's a notion in our society today, in our kind of modern culture, that detox just means doing something to flush toxins out of the system. Maybe there's a gallbladder flush, or we do fasting, or some way of just getting toxins out. And I explained to her that it's much more delicate than just moving the toxins out. I've heard my teacher, my Ayurvedic teacher, Dr. Mishra, say many times that we treat more patients for the effects of bad detoxification than for the toxins themselves. In other words, toxins are something in the system that are poison. And being poisonous, they poison the system that they're in. Now, when we take them out of the body, they have to go through the body to get out. And if we're not careful, they'll poison other systems as they're trying to move out. Or if they're not able to get out of the system for some reason, then they can move into some other area of the body, maybe some deeper tissue. Maybe they go from the fat to the bone or the nervous system, and then they poison that area. And then we've got other problems, maybe more serious than we had before. So we don't allow toxins to come out, or we don't encourage toxins to come out of the system until the patient's physiology is ready for that. And what do I mean by that? Number one, we have to have good bowel movements. Bowel movements, toxins come out through the bowel, through the urine, and through the sweat. And so we have to have good bowel movements. So if the patient's constipated, or they're a little sluggish, or they're having some problems in that area, then detox isn't appropriate for them, because we may loosen the toxin from one tissue, but they may not go out. So bowel movements have to be good. Digestion has to be good. If digestion is weak, then we're just making a lot of toxins from weak digestion. So that has to be corrected before trying to remove the toxins that have already accumulated. Otherwise, the analogy I use is that we're filling a bucket with a hole in it. Another thing is that we have to have an alkalized system. That means that our pH needs to be more on the neutral side, or at least only slightly acidic. And these days, most people's blood pH is slightly acidic, or actually very acidic, and we have to bring that up more towards an alkalized level. When the body is more alkalized, then the channels through which the toxins have to go through will be more open, more lubricated. Now, these toxins that are sitting in the system are often, and there are many kinds of toxins, we'll talk about that in another video, but the kind of toxin that's most destructive to the system when it's coming out is called amavisha. And ama means an impurity, but visha means poison, so that poison aspect. And I've heard my colleague Dr. Teitelbaum give a good analogy for this. She says that ama is like you don't clean your dishes from the morning and you come back that night and you have ama, but amavisha is like you don't clean them for 2 weeks. So you have this rotting acidic material, and that's the type of toxin that's often in the system. When that goes through the channel, if the channel itself, the detoxification channel or elimination channel, is also acidic and dry and maybe swollen because it's inflamed, then that toxin can easily get stuck in the channel, may even damage the channel itself. So we have to prepare the channels in such a way that those toxins can go out. And then the last thing is the time of year, because different times of year our physiology responds differently. In the summertime, it's not a good time for detox because it's going to be hotter, more chances for inflammation. In the wintertime, the channels are going to be more tightly closed because of just the decrease in circulation. So the best time for detox is in the cool season, spring, and in the early fall. We have to look at everybody's physiology in the light of what their particular constitution is doing. Are they ready for detox? Is their system more alkaline? Is their digestive system strong enough? Do they have good elimination? What is the overall health of the person in terms of debilitation or strength of their physiology? All of these things have to be considered, and then the toxins can be removed very, very easily if done in the proper conditions. Otherwise, it can actually create more problems and actually cause more disease. So this is the answer to that question. And if you have other questions about detoxification, feel free to ask me.